Hi, I'm Carrie Ham. Welcome to Jumpstart to Clinical Part 2. I want to welcome you this morning to the simulation lab. This is a new addition to the nursing program. You'll see in the simulation lab that we have multiple human patient simulators. They kind of mimic the human body where they have pulses, lung sounds, bowel sounds. And as you go through the nursing program, you'll have an opportunity to have some learning experiences here. This morning what we're going to be doing is I'm going to be doing a simulation that shows you some of good behaviors and bad behaviors that students do in clinical. I want you to pick up on the bad behaviors that I'm doing, but also the good behaviors. So if you want to grab a piece of paper and a pen or a pencil and we'll get started, you can pause your video right now if you'd like to go get that paper and pencil. Otherwise, what I'd like you to do is have two columns. The first column you can label good, and the second column you can label bad. I want you to document what you're seeing me do as good and what you're seeing me do that's bad, so you don't replicate my bad behavior in clinical. These are the types of things that we as your instructors will be looking for to make sure that you're not doing in clinical. So let's get started. We're going to start the morning as if we come on to clinical, and we're going to start caring for our patient. All right, we're going to enter our patient's room. Good morning, Mr. Ham.
Good morning.
How are you today?
Oh, I'm doing fine.
Good. I'm Carrie. I'm your nurse this morning. We're going to give you a bath this morning, okay? So
Okay.
I'm going to get you all set up for that. I'm going to move your call light. First, we have to take all your clothing off and get this dirty sheet off of you. I'm going to get your supplies. I have warm water, washcloth, and towel. At this point, as the student, you would not want to leave your resident or your patient uncovered like this. You only want to uncover the parts that you're working with. You want to keep your patient warm at all times. And then make sure when you have your patient uncovered and you're performing your partial bath that you have the door closed and provide for patient privacy, either with the room door or a privacy curtain. So I would be starting with the face and the neck. So actually at this point, I wouldn't have my patient uncovered at all. I'm going to raise the bed to a working level. Usually working level should be about hip height. Unfortunately, this bed doesn't go quite that tall, but we'll work with what we've got. All right, I have some warm water here, my washcloth and towel, and my soap. I'm going to start with my patient's face. Therefore, I'm not going to use soap. But once I do the rest of the bath, then I'll use soap for those areas. I'm going to put on gloves so I can maintain my safety and infection control. Get my wash rag damp and wet. And then I'm going to make a mitt. I'm going to start with the face and the eyes, so I'm going to take his glasses off. Mr. Ham, I'm removing your glasses so I can wash your face. I'm going to wash from the inner of the eye to the outer.
That feels nice.
Good. Is that warm enough?
Yeah, that's fine.
And with a different part of the washcloth, I will wipe the other eye from the inner canthus out. Okay? Then I can rinse off my washcloth and I can begin washing the rest of his face behind his ears. I'm done with that washcloth, so I can get rid of that. Soiled. And I'm going to pat dry. Good. All right, if you'll notice, I put my dirty linen on the floor. We don't want to do that. We never want to put dirty linen on the floor, so at the end of the video, I will show you the appropriate way to dispose of your soiled linen. I would continue now on to the remainder of the partial bath, including armpits, peri area, and back region. You'll want to make sure that you know the appropriate steps for completing a partial bath and a full bath before you come to clinical. I'll dispose of my gloves. And now, Mr. Ham, I'm going to go and get your medications ready for you, okay?
Okay.
And I'm going to use hand sanitizer always before I leave the room. About a nickel size of hand sanitizer will do, and it takes about 15 seconds to dry. You will need to rub your hands together during that time so that it dries appropriately. All right, we'll leave the room and we'll go out to the medication cart. At the medication cart, I'm going to open the MAR, or Medication Administration Record. And you can see it will have your patient's names on it. I am going to go to Douglas Ham. So here are Douglas Ham's medications. And now I'm going to go to his cart. Here are his medications. If you'll notice, this says Betty Lake. That's actually incorrect, so you want to make sure that you are going to the appropriate drawer. All right, I'm going to check my 5 rights. I've got my right patient, Douglas Ham, and I'm going to check my right drugs, dose, route, and times. So I have carvedilol, 12.5 milligrams, 12.5 milligrams, 1 tablet by mouth, twice daily, expires 9/2014 for 0800, and I have 1 tablet. I'm going to go through the next medication, lisinopril, 10 milligrams, 1 tablet by mouth daily at 0800, expires 9/2014. I will then go through the remaining 2 tablets and make sure that they are accurate as well. Aspirin, 325, 1 tablet by mouth daily at 0800. And furosemide, 40 milligrams by mouth twice daily at 0800, expires 2013, and 1 tablet. Again, I have Douglas Ham, and allergies are penicillin. Here are his allergies, so he does not have any allergies to any of the medications I will be giving him this morning. I will take my medications and put them in the medication cup. All right, Mr. Ham, I have your medications for you. Are you ready to take these, sweetie?
Sure.
All right. I'll raise at the head of his bed. Make sure I have a sip of water here for him. Which I do not. So, can you take these without water this morning?
I guess I can try and chug them down.
All right, well, let's try it. Okay, and so we're going to give him his medications, and oh, they fell out.
That's on my pillow, right?
That's on your pillow. So we have a couple of choices. Either the patient could pick them up and take them himself, or I could pick them up with a gloved hand. I never want to touch a patient's medications without a gloved hand. So I'm going to actually pick them up for him. All right, here you go. And he takes one and the other, and he takes the other 2.
Thanks, honey.
Oh, you're welcome, sweetie. I hope you have a great day. All right, So you saw a couple of errors today when we were doing this simulation episode. You saw me walk in the room and maybe not knock on the door and provide for patient privacy. You saw me walk in the room and not use my hand sanitizer as I walk in or as I leave the room. So you always want to make sure you do that. I also left the room with the patient's bed in high position. You always want to make sure that you lower the patient's bed for safety reasons. Another thing that you might have noticed is I did not tell the patient that their call light was within reach when I left the room. You always want to make sure that you have the patient's call light within their reach so that they can call if they need help. Some of your patients will have a call light that's movable like this, and sometimes they will be attached directly to the bed. But you do need to let your patient know where the call light is located, so if they need you, they can call you. When you are disposing of your soiled linens, there is a policy that you should follow. First, you should have a plastic bag. Usually they are a clear plastic bag. You'll find them located somewhere in the patient's room. What you should do is open up the bag and make a cuff with the top of the bag. And as you use your soiled linens, you should place them in the bag. The bag can be placed on the foot of the bed if you are doing the bathing in the bed. If you're doing the bathing while the patient is in the bathroom, you could put the bag on the back of the sink or on the back of the toilet. And you're just going to take those soiled linens that we used earlier and place them right in the bag, making sure not to touch the outside of the bag with the soiled linens. Once you are finished with your bathing, you can remove your gloves, wash your hands or use your hand sanitizer. Then come up from underneath that cuff of the bag, making sure not to touch anything inside, and you can tie that bag now. You can take that bag then out into the hallway where the soiled linen cart or room may be located, because the outside of this bag should be clean. You also heard me call the patient Sweetie and Honey. We never want to use pet names when we're referring to our patients. That's an invasion of their privacy, and it's disrespectful and doesn't maintain their dignity. You may have also noticed that when I was preparing the medications and I checked the 5 rights, as I stepped away from the med cart, I left that medication administration record open. We never want to leave that open because that's a breach of patient confidentiality. So whether you have a hard copy paper format of a MAR or whether you have an electronic version through an electronic health record, that you would want to sign out or log out of, and the paper MAR you would want to close to maintain the patient's confidentiality. And before you give medications, you always want to ID your patient. You want to ask them, please tell me your name
Douglas Ham,
and your date of birth.
December 28th, 1965.
And you would want to be comparing that to the bracelet that the patient might be wearing. Now, in long-term care, your patients might not have an identification bracelet because this is their home, so we don't want to make it institutionalized feeling. So if you did not know your patient and they were not able to verbalize their name and date of birth for you, you could have a second person identify and confirm that this was actually Douglas Ham. Then you would be able to safely give the medication. And you may be wondering how I know how to care for my patient and what their requirements and needs might be. You will have an opportunity to view the patient Cardex at clinical during your prep time. It will give you some background information on your patient, including their mental state, their diet, elimination needs, maybe how often they go to the bathroom and if they are continent or incontinent, skincare, grooming, mouth care needs that they have, any activity restraints or restrictions that they might have, range of motion exercises that they perform. So this will give you some background information on your patient that you can use to care for your patient safely and effectively. I hope you found this Jumpstart to Clinical beneficial. We are hoping that you'll take some of the items that you've learned while you watch this video and apply them at clinical, and we look forward to seeing you very soon.